Welcome to People. I'm Micah Matera. Let's get started. Cold and flu season now brings another component, COVID. So where's the city on vaccines? How are Chicago's historic disparities creating problems for equitable health care? We're tackling those topics and more with Dr. Ngozi Ezike. You'll remember her from her previous role as the director of the Illinois Department of Public Health. She's now serving residents as the president, CEO of Sinai Chicago. And she is gracing us with her presence because we think of you, I'm not going to call you the COVID queen, but you got us through COVID in such a graceful and educational way. So I appreciate you, and I'm just so happy that you're here in our studio today. Let me start off by talking about COVID a little bit. It has not gone away. It is here, and it's ramping up right now, isn't it?
Yeah, I mean, COVID is, we've got to be clear, it's going to be with us, just like the flu is with us. And so we have to always be thinking about it. But fortunately, we're not in the days of yesteryear, thank God. And so we have to just use our common sense precautions. And, people have hopefully been keeping up with their vaccinations. And, it's not just COVID, right? It's flu season, it's RSV season. And so we really just need to, use some common sense precautions and keep thinking about the things that we can do, not just to keep ourselves safe, but people around us as well.
There is a latest COVID vaccine out right now that everyone really should get, especially those 65 and older, immunocompromised, et cetera. Will we see more vaccines coming out in the future?
I don't know. It looks like, there's going to be, the opportunity to keep putting out new kind of boosters with the most updated variants so that you can get closer match. And so this new one just came out in September. I know a lot of people haven't gotten it yet.
I got mine.
All right. And so, it's definitely recommended. And again, people are, using their own discretion and trying to figure out their risk levels, et cetera. But it's definitely, they're available. You can get it at the same time as your flu shot. They also want people to talk to their doctors and think also about the RSV vaccine.
There are so many vaccines. You've got the pneumonia, the flu, the RSV, like you said, the COVID, shingles and things like that. Should we get all of them?
The thing is, vaccines are our friend, you know? If we think about some of the vaccines that didn't exist was the reason that kids got polio, that people, died of the measles. And so we really need to embrace this technological advance. It's really the reason that half of the kids used to die before they reached their 5th birthday because of all these diseases that now we really just talk about because we have all these vaccines. So they need to be embraced. It seems like a lot of pokes, but I would definitely have a poke than be in the hospital with one of these diseases. And that's really how we should think about it.
And it is the holiday season. We just passed Thanksgiving, and hopefully everyone got through the gathering okay. But Christmas is coming, New Year's, Kwanzaa, things like that. Folks should really think about the vaccines. They should really think about when they're traveling to wear masks to keep not only you safe, but your partner or the person sitting next to you safe. And it's really not that big a deal. I like how you say a poke is better than being in the hospital, and a mask is better than being in the hospital, isn't it?
Yeah. No, and again, I'm very sensitive to the mask fatigue. And, I know people are going to have to make those decisions for themselves. But I really think as we talk about these common sense things, whether, I don't know what you have, whether it's COVID or the flu or a cold, nobody wants that shared with them.
Exactly. So that's somebody else's germs you don't want. Exactly.
So keep them to yourself if you know you're going through something. Put a mask on. Let's just take care of one another in just a really basic, be good to one another kind of way.
Should we be distancing when we travel, or should we definitely just do the mask? Is that, how much should we be kind of staying away from our people?
I am such a person that wants to hug and embrace, and that is how I greet people. And everybody is, I don't believe in strangers, and so I will connect with people. And so, obviously, as we are looking at the numbers, I know at Sinai Chicago, let's say November 1st, there was probably 1 person in the hospital with COVID. Now they're probably in our system about 6. So I see it's ramping up. We just do need to be aware that, winter and January is usually the peak of all of these respiratory illnesses. And so people need to govern themselves accordingly.
Right. Since we're talking about the holidays, there's a high rate of suicide during the holidays too. What do you say to folks who are out there and, you know, should they just don't ignore other people who seem like they're having trouble, right?
Yeah, I mean, again, like we need to look out for one another. We are our brother's keeper. And, you know, some people, the holidays are like, oh, this is so great and I'm going to connect with family. And for some people, it might conjure up really bad memories, or maybe family isn't a positive thing. And so really just looking out for one another, reaching out, you know, whether it's a coworker from work or someone that you know from the neighborhood, whether it's an elderly person that you know is alone. Like, we just need to be human, just be human.
And one more thing, we need to not forget that there are disparities as far as healthcare in the different zip codes in our city, right? How can that be changed?
I'm so glad you asked that. We all need to be asking that question. You know, we are a world-class city. Our mayor always talks about this as the best freaking city in the world. But we also have to make sure that that's true for everybody. And so thinking about these zip codes, the areas that Sinai Chicago serve, you know, on the southwest and west side, we're not getting all the best outcomes. And so we really need to think about how we can support these under-resourced communities, these, you know, previously under-invested in communities.
It's like a medical desert
and
in
really
some areas,
think about, you know, what are the resources and the partnerships and the collaborations that are necessary to support a Sinai Chicago or other urban safety net hospitals that are really working to narrow those disparities. And, you know, anybody who wants to be a part of this work, we are here.
Yes, thank you so much. Thank you so much for being here. And I understand you're going to be with us a lot more coming in the future.
Can't wait.
So appreciate it.
Can't wait.
And Happy New Year and Merry Christmas and all that other stuff.
All of that.
You can find more online at SinaiChicago.org and on social at Sinai Chicago.